Hello everyone and welcome. Today we're going to go over our MIPS quality control data and see how we're doing. I'm Anne Free and I've been going through the data to see what we can do to improve the quality of care for our patients as well as to help our bottom line. The things we're going to discuss today are the quality measures for our diabetic prevention. We are also looking at other quality measures in terms of the MIPS program, but today we're going to focus on these particular ones related to diabetes. We're going to see how our providers are doing, how it's affecting our practice, and how improving our care and our bottom line will all work together as a whole. The 5 measures that we're going to evaluate today are going to be the annual eye exam, annual foot exam, the neuropathy check, getting an annual flu shot, and the vaccination for pneumonia, otherwise known as Pneumovax. To start with, there is the annual eye exam. The information you see on the screen comes from the MIPS database, and the information on the quality control number, and the more intricate information is listed in more detail there. What the patient side of things notes is that we do need to get an annual eye exam for diabetics because of the small vessel damage that can occur with poorly treated diabetes. Those vessels can get clogged, can cause retinopathy, which could eventually even lead to blindness. Therefore, making sure that we're checking this on an annual basis will help promote treatment and early detection. Across our clinics, we're not doing the greatest, but we're not doing that bad. In particular, we can see in the orange highlights that where we're meeting our target goal of getting at least 60% of our diabetic patients in for their annual eye exam. We do have a couple holes, particularly in one clinic where we're only gathering data from 2016. However, we can also see that there are definitely some dips at certain clinics where we're really just not getting our patients adequate preventative care in this situation. When we look in more detail, we can see that we've hit our benchmark really only 27% of the time in 2016 and really 30% of the time in 2017. Our only 2 clinics to hit it on both sides are going to be our Aroostook as well as our Knox clinics. Oxford comes very close. It hits it on the 2017 mark and almost there for 2016. Franklin is definitely very far behind, not even getting up to the 20th percentile. And then we also noticed in the Androscoggin clinic that they hit it for the first year, but then there was a significant drop in the second year. Looking at these protocols, we'll need to see where we might be able to make some adjustments. Moving on to the annual foot exam, again, the data there from the MIPS program. We do recommend the annual foot exam as neuropathy can be a problem in our diabetics, where there is decreased sensation in the feet, which can often lead to potential ulcers, cuts that really aren't noticed by the patient. This is where we'll often start looking for sensation difficulties, coolness to the foot, definitely preventing any type of amputations down the road. Again, we can see across our clinic that we're doing decent, but really not the greatest. Franklin Clinic, again, is somewhat down. Our Aroostook Clinic as well as our Knox and Oxford clinics are, again, excelling in these measures. We're looking to get at least 80% of our diabetic patients to have their annual foot exam. And again, we do see this very large drop in the Androscoggin Clinic, where it hits almost to our benchmark on the first time, similar to what we had seen in the eye exam, and then dropping to below 10% in the second one. Again, our benchmark hits are about the same for 2016, 2017, and again, we're seeing that our Aroostook, Knox, and Oxford clinics are doing much better than the rest of our clinics. Third one that we're going to go over is the annual check for neuropathy. This is typically looking at how our kidneys are functioning. Again, a problem that can occur with diabetes is poor functioning of the kidneys. We can monitor this closely, make sure that we're medicating appropriately, and hopefully prevent eventual need for dialysis down the road. We're not doing very well in this particular category. You can see across the board, we do set the benchmark very high at the 85% mark, but really none of our clinics have been able to get up there. We do have a couple up at 80%. Similar clinic distribution to what we have seen previously for our prevention of diabetes. Again, with our Franklin Clinic being down, a large dip in our Androscoggin, and our Aroostook, Knox, and Oxford clinics, again, tending to be a little bit more excelling. However, again, we did not hit the mark in any of those. Additionally, we recommend the flu vaccine. Our diabetics are at higher risk of getting infections. thus making sure we can do as much as we can to prevent those, such as getting the influenza immunization can be beneficial for these patients. This, as you can see from the data, is very poor. We're looking to just hit 65% of patients. Really, the data is not very good here in the fact that, number one, we're missing quite a few of our clinics for reporting purposes. And we're also, the ones that are reporting are really not hitting the mark that we'd like to see. And finally, we do look at the pneumococcal vaccine. This particular benchmark does look at for those that are over 65 years old. However, it is also recommended for less than 65 for our diabetic patients who, again, are at increased risk for infection. Thus, we want to get them as much prevention as possible. We can see we're not doing too bad on this particular mark. Our benchmark is at 65%. Our ARS2 clinics, Knox clinics, and again, almost to the Oxford clinic can make this doable. We see Cumberland actually coming in this time to do a little bit better. Our Franklin clinic, which had been previously not doing well in our other measures, seems to be doing pretty well and hitting the benchmark here. Again, we are missing some data within these years, but overall, this is probably our best performing benchmark that we have throughout the other, for the total of the 5. So again, we are missing the mark quite a bit on these. We're hitting very low percentages for getting to our benchmarks. Not only is this going to have poor patient care, as we should be hitting this per the guidelines of diabetic management, we could be missing many other issues going on with our patients. We'll definitely need to kind of work with our providers to see what we can do to improve this. The other problem that we can see with this is that it's going to lower our reimbursement. As we move into more of a value-based care model with MARCA and now these MIPS criteria, we need to not just have patients come in for their every 3-month check on their diabetes. We need to be making sure that we're doing a good job getting these things under control. So how can we help this moving forward? What we can definitely do is start to creating some more protocols for our diabetic management. We can decide how we can get these under control so that we are getting the annual checks for each of the preventative measures, really encouraging influenza and flu vaccines, and doing our best to do so. Since this might not be possible at every patient care visit, a great option would be to have some care managers at each site that are working through the registry data, reaching out to these patients to see and make sure that they have had these things done. Another option would be to discuss how well the Oxford, Knox, and ARS2 clinics are doing, and filter this out to the rest of the clinics. Maybe they already have some protocols set in place. That's why they've been successful in many of these benchmarks. Or maybe they just have more personnel and that might need to be done and filtered onto the rest of our sites. Once these are all in place, I do feel like we should reassess this data in about 3 to 6 months so we can get a better sense of if we're seeing the improvement with the information that we've done. Of course, there can be other options going forward here too, and so I do open the floor to questions. Otherwise, thank you very much for your time.